Hi there, I'm Dr. Rajita, faculty of Next Fellow. So today's topic is on thoracic duct. Thoracic duct is otherwise called as Piquet duct. So just note it down. Thoracic duct is otherwise called as Piquet duct. So if you see this thoracic duct, it is the beginning of continuation of Cisterna chyli. It begins at the level of T12 vertebra from T12 vertebra, where it ascends into the posterior mediastinum through the aortic hiatus, that is the opening present in the diaphragm through which the aorta passes through. So along with the descending thoracic aorta, it enters into the posterior mediastinum. And thoracic duct, it appears to be beaded because it contains numerous valves. Thoracic duct, it passes through the aortic hiatus through the diaphragm at the level of T12, and it runs along with the azygous vein. So you can see here, this blue one is the azygous vein, red one is the aorta. So the thoracic duct is sandwiched between these two structures. And at the level of T5, you can see here the thoracic duct crosses. So it deviates towards the left side. It goes towards the left side. So this here is the left side. It deviates towards the left side. And further it ascends in the posterior mediastinum till it reaches the apex of the left lung. That is almost it passes through the thoracic inlet, and where it arches over the apex of the left lung, left pleura, and between the left carotid sheath and vertebral artery. So anteriorly it is related to carotid sheath, and posteriorly it is related to the vertebral artery. And further it runs behind the internal jugular vein. We can see here, this is the internal jugular vein. So it runs behind the left internal jugular vein and terminates in the left subclavian vein, just at the formation of brachiocephalic trunk, left brachiocephalic trunk. So that is the termination of thoracic duct. The drainage of the thoracic duct, it drains almost whole body except few areas. So you can see here on the left side, the thoracic duct drains into left subclavian vein, and where at the junction of formation of left brachiocephalic trunk, where the left internal jugular and left subclavian meet, that is about the left side. On the right side, there is a similar duct called as right lymphatic duct, which opens into right subclavian vein. So right side, right subclavian vein, left side, thoracic duct drains. So whole green shaded area is the area which is drained by the thoracic duct, and white shaded area is drained by the right lymphatic duct. So almost whole body, that is both right and left limbs, abdomen till the level of diaphragm, and the left side of the left upper limb, left side of the thorax, left neck, left side of the head and neck region. So all these are drained into the thoracic duct. So tributaries of the thoracic duct. So bilaterally, the right and left descending thoracic lymph tracts, you can see these are the lumbar lymph trunks which are open into the cisterna chyli. Cisterna chyli continues as the thoracic duct, and then it gives so many intercostal ducts we can see here, which in the lower intercostal spaces, which convey the lymph from 6 to 11, and upper left intercostal lymph trunk, and also which convey the left upper intercostal spaces of 1 to 5. Then mediastinal lymph trunks. So mediastinal lymph trunks are present in the posterior mediastinum, and the left subclavian trunk. So we can see here left subclavian trunk, left bronchomediastinal lymph trunk, and the left internal jugular trunk, left jugular lymph trunk. So these are the important tributaries. What you can remember is the left jugular lymph trunk, left subclavian lymph trunk, left broncho-mediastinal lymph trunk. Okay, these are the important, and descending thoracic lymph trunks, right and left. So talking about this right lymphatic duct, so right lymphatic duct has got a very shorter course. It is a short vessel that drains into the right half of the body above the diaphragm. It begins as the convergence of right-sided lymphatic vessels, that is the right subclavian trunk. We can see right subclavian trunk, right jugular trunk, and right bronchomediastinal trunk. They all converge and they join to form this right lymphatic duct. So it drains into the right subclavian vein, that is at the venous angle, the junction between the right internal jugular and right subclavian vein, which is the beginning of right brachiocephalic vein. So this drains the white shaded area, that is the right upper limb, right part of the chest, right head and neck regions. These areas are drained by right lymphatic duct. Next, about the cisterna chyli, that is the lower end of the thoracic duct is the cisterna chyli, which is a dilated sac present on the lower end, lies in front of L1 and L2. We know that thoracic duct begins at the level of T12. So L1 and L2 are related to cisterna chyli. So these are the two spellings for cisterna chyli. So located posterior to the abdominal aorta and anterior to L1, L2 vertebra. So cisterna chyli. So we know the cisterna chyli continues as the thoracic duct at the level of T12, where it passes through the aortic hiatus through the posterior side of the diaphragm, that is through the diaphragm, to enter the posterior mediastinum. And let's see some MCQs related to thoracic duct. So thoracic duct opens into, I hope you all know the answer. So subclavian vein, internal jugular vein, right brachiocephalic vein, left brachiocephalic vein. So it goes into the left side. So it opens into the left subclavian vein. That is the answer. And or else it is the formation of left brachiocephalic vein. So opens into the left venous jugulo-subclavian angle. You can say it as jugulo-subclavian angle at the beginning of left brachiocephalic. So here the side is not mentioned, so you have to go with this answer. Thoracic duct receives the tributaries from all the following except bilateral ascending lumbar trunk, bilateral descending thoracic trunk, left upper intercostal duct, right bronchomediastinal trunk. I hope you all know the answer. Right bronchomediastinal trunk is the answer because right bronchomediastinal trunk converges with the other trunks to form right lymphatic duct. So we can see here right bronchomediastinal trunk joins with the right subclavian, right jugular to form right lymphatic duct. So that is not the, so rest of the things, they are all the tributaries of the thoracic duct. Ascending lumbar trunk, the descending thoracic trunk, and left upper intercostal ducts. All these are the tributaries of thoracic duct. So this completes the thoracic duct in a short way. Thank you.